Hey everybody, good to see y'all. All right, I'll be seeing y'all as you join. Welcome. I'm so excited. So tonight, as promised, I'm going over my most frequently asked questions about my upcoming medical practice, Nspire Primary Care. Welcome, Las Vegas meetup. Welcome everybody. So, I'm going to just do a little intro, tell you what we'll be talking about tonight. If you have any questions as we go, drop it down below and I'll try to answer it, okay? Okay, so just to review, we're coming live tonight to talk about my upcoming medical practice, Nspire Primary Care, that's coming to Las Vegas. February, I'm so excited. So it's coming February. And our pre-enrollment opens tomorrow. I can't even believe already December 1st is here already, okay? So tonight I'm going to be going over my top 5 most frequently asked questions. If you drop any other questions, hi everybody that's joining. You guys put where you're from too in the chat. Obviously, if you say Las Vegas on your name, then I know you're from Vegas. But otherwise, drop in the chat where you're from. Of course, our practice is going to be located in my hometown, Las Vegas. I'm back home. I'm so excited. I'm in my backyard, so if it gets loud or noisy out here, just let me know, okay? But let me give you a little background on who I am. So I don't go live often, but I'm going to change that. So I'm Dr. Jade. I'm a family medicine physician, and I'm going to look down every now and then because I do have notes for tonight, okay? I'm a children's book author. I'm a wife. I'm a mom. I'm a Christian. And I'd like to think I'm just a good person, that is really passionate about health and wellness and reversing and preventing chronic diseases, okay? That is my why in medicine. I want my patients and my clients to be as healthy as they possibly can and have their optimal level of health. And I know the evidence-based methods to transition to your optimal level of health. So I try to share that through my YouTube channel, through my Instagram, and of course with my patients and my clients that I work with through wellness consulting, okay? So that's a little background on who I am. I am an entrepreneur at heart. I always have been. And my husband and I own a business called Nspire LLC that our children's books and some of our other products and services are ran through. And our second business, Nspire Primary Care, that is now opening, that we'll be talking about tonight, okay? Okay, so what is Nspire Primary Care? It's a membership medical practice, a modern membership medical practice. We'll get into what that means later because that's one of the most frequently asked questions is like, what is a membership medical practice? So we'll get into that. Okay. And again, pre-enrollment opens tomorrow. At the very end, I'll tell you how to pre-enroll and what that even means. Okay. So let's jump right into the most frequently asked questions, the top 5. I'm going to take a sip of water, drop in the chat where you're from so we all know. And also, let me know if you have any questions in the chat, okay? And I'll try to answer those too. Yes, there's water in my red cup. Okay, so here we go. So the first most frequently asked question that I get quite a bit is, what is a membership medical practice? What is a membership medical practice, okay? So this style of practice is called direct primary care. Las Vegas meetup is from Vegas. Yes. Okay. I see you. Thank you. So this style of practice is called a direct primary care practice. You'll often hear the acronym DPC. Okay. There are over 1,000 direct primary care practices all across the United States. I believe I will be the 6th direct primary care practice in Las Vegas, and I will be the first Black owned or Black physician in Las Vegas with a direct primary care practice, okay? And so what that is it is a flat monthly membership fee, and that gives you access to unlimited primary care services, and that gives you direct access to your doctor. Meaning my patients will all have my cell phone number. Yes, you did not hear me incorrectly. They'll have my cell number. They'll be able to text me. They will have guaranteed same day, next day appointments. They will have extended 30 to 60 minute appointments. So they just tell me if they want a half-hour appointment, if they want a full-hour appointment, we make it happen. And if they want a shorter appointment, of course, that's fine, but I'll block off 30 to 60 minutes. So it's unrushed, okay? This model of care allows better quality care. It's amazing. And practices that have been doing it this way have been thriving throughout the country, okay? And I'm excited to join this type of care. So why am I doing this? Why am I not just going and getting employed and getting a job? I'm fresh from residency, and people are like, why aren't you just gonna get a job? That'd be easier. So I'm gonna answer that question. So I'm fresh out of residency, and it already burnt me out a bit. And that is because the quality of care went down, because in our traditional healthcare system, doctors, a lot of people don't know that doctors have a time constraint on how long they can be in the room. So often appointment times are 8 minutes. A lot of people don't know that doctors' pay can get docked if they stay in the room longer than that small amount of time. So, I will get to the insurance. That's one of the most commonly asked questions. That's number 2. So that's coming next. And thank you so much, Las Vegas Meetup. So I'll get to that. So yes, 8 minutes in the room is standard. 15 minutes appointments are standard. Stacked patient appointments, even double booked patient appointments are standard, which makes patients have to wait in the waiting room for hours to see their doctor. So your patients are frustrated, the doctors are rushed. And another thing, a lot of people don't know about that time restriction. Yes. And a lot of people don't know that doctors' pay in the contract can get docked and deducted if you consistently run over time. So it's a whole thing. Okay. Doctors don't like being impersonal either. It is how our system is built right now. Of course, my neighbors want to work on their yard right now, so let me know if it gets too loud, okay? And another thing people don't know is each primary care doctor, on average, has 3,000 patients assigned per doctor. I'm one person, I'm one doctor, and I have 3,000 patients. So that is why you will find often that your doctor can't remember who you are, can't remember your medical history, will ask you questions you've already answered before, and all of that, where it's just like, other thing is that's why your doctor is at the computer the whole time looking at the computer screen, because we have to get it done quick because we have all these patients stacked in a row. And then if we don't document while we're in the room, then we have to take all that work home and document at night when we're supposed to be spending time with our families or getting some rest. So the only solution for a doctor is to look at the screen and type the whole time. It's so impersonal. And I did not go into medicine to treat patients that way and to have that type of quality of care. Okay. Yeah, thank you. Right? Yeah, we want happy doctors, but we want happy patients. And that's a healthy physician-patient relationship, right? Is when, the dogs are barking. I guess they hear me. So when I'm providing quality care and my patients are happy and I'm happy, that is a healthy patient-physician relationship. So anyway, that is why I'm doing this practice. A lot of people will call this membership medical practice. They will try to compare it to being like a gym membership, or like a Costco membership, or like a Netflix membership. So you pay a monthly fee, which direct primary care is slightly different from concierge. A lot of people have heard of concierge medicine, like, Michael Jackson and most of the celebrities have a concierge physician that comes to their house and is like their personal physician, has a cell phone number. This is basically a more affordable version of concierge medicine. Also, concierge medicine bills insurance. I'll get to the fact that we don't in a second. So that's another differentiation. But the biggest difference is the price, right? So you could say that direct primary care is like concierge medicine at an affordable rate. So most people can afford direct primary care membership rates, okay? And I say it's like a gym membership or a Costco or a Netflix because you pay that flat monthly fee and then you have unlimited access to the services. And I will get to what the services are on one of the next points, okay? So we're moving on. So that's what a membership practice is. I hope that answered your question on that. That is number 1 of 5 most frequently asked questions I'll go over. Let me know if there's still any confusion about what a membership practice is, and I can, answer that later. Okay. Number 2, drop in the chat if you joined us. Drop in the chat where you're from. I'm going to take a sip of water and then I'm going to go to number 2. Okay. So, do you take my insurance? Okay. That is the second most frequently asked question about Nspire Primary Care. Do you take my insurance? And then the other question is, can I join if I don't have insurance? Okay. So, because I've now explained what a membership medical practice is, all the billing that I do is the monthly membership fee directly with my patient. I do not bill insurance at all. A membership practice does not bill insurance at all. Direct primary care practices do not bill insurance at all. Okay? So what does that mean? That means if you have insurance, wonderful. We encourage insurance. We are not saying that you don't need insurance. We're just saying that you do not need insurance for your primary care services, which I'll go over next what that is, right? What you do need insurance for is the same thing that we use most other insurances for, emergencies, right? Your car insurance. You don't use your car insurance when you're going to pump gas. You don't use your car insurance when you're getting a car wash. You don't use your car insurance if you're getting an oil change. You don't use your car insurance if you need a new battery, okay? No, you use your car insurance when you get into an accident, okay? When there is an emergency, you're like, oh, where's my insurance? That is how insurance should be utilized. And this style of practice is using insurance properly, okay? You don't need it for primary care services. Thus, we do not bill insurance, okay? So what that means is that your membership fee is charged. You have unlimited services, access to our services. If you have insurance, which you need insurance, and we encourage insurance, but you use it for things like surgery, your medications, your labs, if you need to go to the emergency room, if you need to be hospitalized, if you need to see a specialist. So those are the times to use your insurance, okay? So hope that answers the question. Oh, the other question is, well, what if I don't have insurance? If you do not have insurance, again, you can become a member of the practice because all that is required is the membership fee, which is directly from your bank account, right? So we don't bill insurance at all. Hope that answers that question. That is a very common question. I do understand that this is a different way of thinking about medical services and going to the doctor's office. Everybody's used to that copay. Everybody's used to pulling out their insurance card and being like, what insurance do you take? But again, for primary care, we have found that it is actually not necessary. I don't need to know what insurance you have to refill your lisinopril for your high blood pressure. I don't need to know what insurance you have to counsel you about weight loss and to do all the other services that I provide that I'm going to go over next. So that's question number 3, is what services are included in the membership. Let me take a sip of water. Let me know if there's any questions. Hi to everybody that's here. Thanks for hanging in with me. So we're going on to number 3, what services are included in the membership. Let me grab a sip of water and we'll go to that next. If you just joined us, put in the chat where you're from, okay? Okay, so here we go. The services that are included, I mean, I could go on and on about what services are included because primary care covers about 90% of healthcare is primary care. So most things you will go to a doctor for outside of emergencies, surgeries, what else? If you need to go to the emergency room, outside of those things, then that's not primary care. But almost everything else is primary care. And so it's really everything in one place, which is why I love being a primary care doctor because I never get bored. So let me just give you some examples of the things we cover, okay? So we cover urgent and acute care needs. That would be like if you get a urinary tract infection, an upper respiratory infection, if you, cut yourself and need stitches. So all of that is like urgent care needs. All of that is covered, okay? And so adult, women's, and men's health, all of that is covered. If you need your pap smear, your prostate checked, if you want to talk about depression, anxiety, acne, any of that type of stuff, covered. Chronic care, so that is if you've been diagnosed with something like asthma, diabetes, high blood pressure, we take care of all of that, managing all of that, okay? Preventative care, which is what I'm super passionate about, okay? And that is your wellness visits, talking about nutrition, your sleep, your weight management, or even weight loss if you're overweight or obese, your cancer screenings, like your colon cancer screenings, things like that. All of that is handled under primary care, okay? Pediatric care, meaning your newborns. Yes, we see what we call womb to tomb medicine. So we see newborns, infants, your well child exams. What else? Your teens, your sports physicals. All of that is included. And then procedures. I love procedures. So my procedures are included. There may be some small fees for if there's specific equipment that's needed. For example, if I need to do a splint, then there may be a small fee for the material. But otherwise, the procedure itself is included, meaning knee injections, shoulder injections. Again, if you need stitches, skin tag removals, to also any type of biopsies that are needed of the skin, toenail removals. I mean, family medicine doctors do a lot of procedures. So all of that is included. Can you believe that? Like, that is not traditional, okay? And so that is very exciting that this style of practice gives us the freedom to just not have to be like, oh, you need your toenail removed. Let me go check what your insurance is and if they'll pay, No, we could just remove the toenail. It's not a big deal that needs to be like, search through this third party. I'm the doctor, you're the patient, this is what we need. Let's just do it. We can do it here now. So I love that. So, okay. Hope that answers the question. What services are included in your membership? Let me know if there are any questions about that. Okay. And then I'm going to grab a sip of water, put in the chat where you're from. Thank you for hanging with me. We've got 2 more. So that was number 3. We're going over the top 5 most frequently asked questions tonight. And we're going to go over number 4 next. And that question is, can anyone join? Okay. That's another question I've been getting asked a lot. Okay. So can anyone join the practice, Nspire Primary Care? And the answer is not exactly. So let me tell you the patients that cannot join my practice at this time. If you are over 65 years old, at this time, I cannot accept any patients that are Medicare eligible. Meaning if you're 65 or older, there are government regulations that do not allow me to charge a membership fee to people that have Medicare or in general are over 65 because they're Medicare eligible, that have Medicaid, that have TRICARE, which is the military insurance, because these are government-bodied insurance plans that legally do not allow me to charge a membership fee and do not allow them to join a membership practice, okay? And that is just at this time. That regulation for my practice should last about 1 to 2 years. And so I will be collecting a wait list for those patients. And when I no longer have that government restriction, I will then be able to accept those patients to my practice, okay? Otherwise, yes, anyone can join my practice outside of those few restrictions, okay? Let me know if there's any questions about that. I'm gonna move on to number 5, okay? My neighbors again are doing their yard. Let me know if it's too loud, okay? So, all right, number 5, people are like, well, why pre-enroll? If you open in February, why should I pre-enroll? I know pre-enrollment opens tomorrow. Why should I pre-enroll? So there are some benefits to pre-enrollment, okay? First of all, there is a $99 enrollment fee once our doors open in February. Every patient that I onboard will have a $99 enrollment fee. However, if you pre-enroll, that fee is waived. It's getting louder, so hopefully you can hear me. But if you pre-enroll, there is no enrollment fee. So that's $100 savings. I'm going to wave to all the new people that joined. If you just joined, drop in the chat where you're from. Thanks for being here. Okay, so enrollment fee is waived. First of all, we all like to save money. So let's say yes to that. The second thing is you secure your spot to the practice because I will be enrolling our members as they pre-enroll through my website. So what that means is because I have same day, next day appointments, because I have patients having my cell phone number and all of that is a part of the practice, part of the caveat in that is that I have a smaller patient panel. So like I told you, the average family medicine doctor has 3,000 patients. I will only have 600 patients in my practice max, okay? So that means that the first 600 patients that enroll into my practice will be my active members. And after that, patient 601 and on will be on a wait list, okay? That is how I will be able to give that direct attention to my members, because I will have such a smaller patient panel. So the other benefit to pre-enrolling is making sure you secure your spot, okay? So that there's no ifs, ands, or buts about it, that you will be getting that quality care that Nspire Primary Care will allow me to provide, okay? And the other thing is that, the other thing I wanted you to know that I saw in my notes is that important to know that no charges will be made until the in-person appointment with you in February. So even if you pre-enroll in December or January, you will secure your spot. You will not have an enrollment fee, but there will be no charges to your card or bank or anything until after our first in-person appointment, where we make sure this is a good fit, and I get all your medical history and I examine you and we sign all our contracts, honey, and then you will get billed, okay? So good to know that although when you go through the pre-enrollment, which I'll talk about lastly here, they will ask you your medical history and they will ask you your bank account number if you want to already get that set up in the system, but no charges will happen until we meet in person, okay? And the last bonus, so that was number 5. Is why pre-enroll. And the last thing, especially since my neighbors are so loud with their yard right now, here we go. Okay, the last thing is, how do I pre-enroll? Can you guys still hear me? Let me know. So how do I pre-enroll? Our website opens tomorrow, inspireprimarycare.com. There's no I on Nspire. It starts with the letter N. So Nspire primarycare.com. If you go there now, it's a coming soon page. At midnight tonight, which is officially December 1st, the website goes active, the full website goes active, and the pre-enroll button is right there at the top. When you see the page, it says pre-enroll. You just click that and go through the steps. That's how you pre-enroll, okay? And that's Pacific Standard Time, midnight. So that's it. On my website, it explains all this stuff in way more details, you guys. And it also has a frequently asked questions section that has 19 most frequently asked questions, so way more than what I went over tonight. It tells you more about the services, more about some exciting things that I'll have coming down the pipeline, which is a spa that will be associated with it, called Nspire Spa, but that'll be probably next summer that we'll start adding on those type of services, and our members will also have discounts to the spa services and my aesthetic services that will launch probably closer to the summer. So there is so much value that I'm going to be packing in to this practice, in addition to your traditional family medicine primary care services. I hope this answered your questions, the most frequently asked questions. Thank you so much for saying that you're proud of me. I'm just honored and thankful that I even have the opportunity to practice in this type of way. When I heard about direct primary care, I was like, yes, I knew there had to be a better way than practicing the way that I had to practice in residency, you know? And so I'm just excited. I'm living my passion. I'm living my dream. And I'm here to serve my hometown, Las Vegas. If you're not in Las Vegas and you're like, well, I want this too, but I don't live in Las Vegas. Okay, I am licensed in the state of Nevada, so that is where I practice. However, there are, like I said, over 1,000 direct primary care practices. You can look online and put in direct primary care office or doctor, and then your state or your city, and see what direct primary care doctors are close to you, okay? I'm not the only one if you live out of state. If you are interested in wellness services with me, I will be launching my wellness consulting services in the new year, probably in the springtime, and that will allow me to do more of the nutrition and preventative consulting that I do with my clients. But it is not medical care, okay? So I won't give medical advice or prescriptions or things like that if you live out of state. But it does still allow me to work with clients on their wellness. I hope this answers your question. I I do have to plug my books. So I do have children's books, empowerment children's books. You can call me queen, you can call me king. That we are all about inspiring a generation of confident children, and they are beautiful books. They're beautifully diverse, and they are the perfect Christmas gift. And yes, I'm biased because I wrote the books, but they are available on Amazon. Okay, so if you have any other questions, you can always message me on Instagram. I'm on Facebook. I'm on TikTok now. So you can always message me and I try to get back. And if you have any other questions, we do have an Nspire Primary Care Instagram page. You can follow us there. The content there will just be specifically about the practice. Okay? Thank you guys so much. I appreciate all the love in the comments. Thanks for hanging in there with me. Bye.